In this introductory video, you will learn what heart failure is, what causes it, common symptoms, and an overview of how it is treated.
In many ways, heart failure is an incorrect name for the disease. The name heart failure correctly emphasizes that it is a serious condition. Those with heart failure have increased risk of hospitalization or death. However, your heart has not failed and is not about to stop. It would be better to call heart failure heart dysfunction or heart muscle weakness.
The heart works as a pump, supplying blood to your body and vital organs. In heart failure, this pump is not working effectively. Heart failure is often divided into two types. 1. Heart failure with preserved ejection fraction and 2. Heart failure with reduced ejection fraction. Ejection fraction refers to the amount of blood being pumped out by the heart. In heart failure with preserved ejection fraction, the heart squeezes out blood well but does not relax and fill normally. This increases pressures inside the heart. In heart failure with reduced ejection fraction, the heart muscle is weak and unable to squeeze out enough blood with each heartbeat to meet the body's demand.
Even a perfectly functioning heart does not squeeze out 100% of the blood it holds. An ejection fraction of greater than 50% is preserved ejection fraction. An ejection fraction between 41 to 49% is mid-range ejection fraction, and an ejection fraction of 40% or less is reduced ejection fraction. The ejection fraction is one of many factors that influences your risk with heart failure and helps determine which type of treatment will benefit you the most.
Some symptoms of heart failure include shortness of breath or difficulty breathing, swelling or weight gain, arrhythmias or abnormal heartbeats, and feeling tired or weak. Increased pressure in the heart can lead to fluid buildup in the lungs, which can cause a feeling of shortness of breath or difficulty breathing. This trouble breathing is often worse when lying flat at night or bending over to put on your shoes. Pressure can also build up in the abdomen or legs, leading to swelling. And increase in weight. Arrhythmias or abnormal heartbeats may feel like palpitations, racing heart, or dizziness. Increased pressure in the heart can also lead to heart rhythm abnormalities, including atrial fibrillation. The weakened heart muscle does not pump enough blood to keep your body well supplied. This can cause lower blood pressure and feeling tired or weak.
There are many causes for heart failure. The most common causes are disease of heart arteries, coronary disease, high blood pressure, diabetes, genetic causes of weak heart muscle, abnormal heart valves, and heart rhythm disease such as atrial fibrillation. For more information about what may be causing your symptoms, speak to your care team. Many unexplained causes of heart failure are hereditary. Seeing a genetic counselor can be important for identifying a genetic cause and potentially screening family members. The main treatment for heart failure with reduced ejection fraction is a combination of medications that can strengthen the heart and lower your risk for hospitalization dramatically.
Once you are diagnosed with heart failure, it is important to closely monitor your weight, blood pressure, heart rate or pulse, and your symptoms. Keeping a log of these details can help you notice if something changes and can help your care team make the best choices for your treatment. Remaining physically active, stress management, healthy eating, and getting enough sleep are all important too. Before making any changes to your exercise or activity, talk to your clinical team to make sure it is safe for your heart.
It is important to avoid certain behaviors that may worsen your heart function. This includes avoiding smoking
or vaping, alcohol intake, and drugs. We will discuss the details of how to manage your heart failure in our other videos.
Heart failure is a serious but treatable condition that generally requires lifelong monitoring and treatment using a combination of medications. Having a team, both a medical team and a personal support team, is essential to help you through the journey. We hope this video has been helpful.